good, and it may be in our best interest to opt to get vaccinated. Because, Abdul, the law does not mandate or compel anybody to be vaccinated against their will. So people have to be willing to take the vaccine. And that is what the officials are counting on in the next few days, to build up that professional, competence, so that people will have trust in the vaccine and then
and there's international interest in the arrival of these vaccines as well. UNICEF already, we have indicated to you, is playing a key role in the arrival of these vaccines and the acquisition of these vaccines as well. Indeed, Thelma did make a point earlier regarding the fact that when the vaccines were first produced in the Western world, in Europe, in America in particular, it appeared that Africa had been forgotten, and the distribution was focused on persons within these continents and countries that particularly were not as vulnerable to the virus as other people in Africa were. But agencies such as UNICEF came in and have ensured that there is equitable distribution of the vaccines so far. 600,000 have come into Ghana. We're expecting a lot more to arrive in the coming weeks
Abdul,
and
because
months.
mind you, the president has pledged his commitment to ensuring that all Ghanaians are vaccinated. We are talking about 31 million people, some of whom may be initially excluded from being vaccinated. For example, children who have not been trialed with any of these vaccines, and so the effect on their livelihood has not been ascertained. So we know for a fact that children are not going to be vaccinated, at least at this initial moment. There may be other groups of people who, though may be willing to be vaccinated, cannot accept the vaccine because of one or two reasons. And this is outside of those who refuse to take the vaccine for no reason. So we do have a Herculean task ahead of us to achieve herd immunity.
And that's why I earlier made the point that even as the vaccines arrive, we should not become complacent, because even if the distribution started today, it would not get to every Ghanaian immediately.
And what the studies have shown us also is that even if you do get the vaccine today, you do not get automatic immunity. So the foolproof way still remains social distancing, wearing your mask, washing your hands with soap under running water, and then basically keeping to the protocols, avoiding crowded spaces, because there have been instances in the West where people have received the vaccination and have still gone on to be infected. However, the plus side for them is they do not get as sick, and they report even milder symptoms because their bodies have been exposed to a system which allows antibodies to be produced and to fight off the infection.
You mentioned the issue of children. It's instructive to note that just about 2 or 3 weeks ago, the Konfanoche Teaching Hospital in particular did make all of us aware that its children's ward had been inundated with cases of COVID-19. Indeed, at the time, we're told that some children had lost their lives. At least 2 had lost their lives as at that time. But previously, we never heard cases of children contracting the disease, the virus in the first place, and to go on to die was very unfortunate. That the new variant appears to be affecting these children. But unfortunately, they cannot be vaccinated, at least not now. What it then means is that even when the vaccination starts rolling out, we still need to protect our children as well.
We do, and you would also recall that the Ghana Education Service, as part of measures to protect these children, made the very, authoritative decision not to go ahead with any of the 6th March Independence Day activities. 6th March is very dear to the country. It is when we got independence, and children, for as long as I have been around, have looked forward to those activities, to march and give Ghana a little bit of what Ghana has given to them. But all those programs and other related activities to the Independence Day activities have been cancelled. It tells you that the situation needs to be brought under control somehow. And we have to let go of some of the things we love most so that we can protect ourselves to be alive to enjoy them in future.
Thelma, to our left there, we've seen the government delegation led by the Honorable minister designate in charge of health, and you have already told our viewers that indeed he has been in charge of health for the last 4 years. But again, particularly in the fight against coronavirus, he's been very, very instrumental, to the point where at a point he himself was reported to have contracted the virus. But thanks be to God, he has recovered and has continued working effortlessly and hard working towards bringing this virus to a close, so to speak, Thelma. So we also find some members of the diplomatic corps together with the government delegation currently conferring with each other. I'm sure that they are all excited that finally there appears to be light at the end of the tunnel, that this pandemic will eventually be fought and the battle will be won.
I'm very expectant as well, Abdul, and I'm very excited to see the collaboration that the government and people of Ghana have received from their development partners. We can see representatives from the U.S. Embassy. You can see their vehicle and their flag prominently here. You can see some delegations also from the UK High Commission. And then, obviously, as we've said, UNICEF, and they've worked hand in hand with the COVAX team that was put together by the World Health Organization to ensure equitable distribution of the vaccines. As at now, we understand that only 20% of Africa's population has been vaccinated. And those numbers are very low indeed when you compare them to places like the UK, where about 17 million people have already been vaccinated in the past 3 weeks. And in the US, where a lot more people are being vaccinated and being offered the vaccine. So indeed, hope has arrived, I would like to believe, Abdul. And I'm excited to see the collaboration and the dedication with which we are getting support to fight this battle.
Exactly. And again, we having to go back to the genesis of the virus and what the government of Ghana has been doing to ensure that its spread is kept, so to speak. We go back to the weekly press conferences. In fact, every week there are 2 press conferences since March of last year to address issues relative to COVID-19. You believe that in some way has helped to keep the numbers where they are now, even though we are complaining that well, we've recorded too many deaths.
Yeah, and the other thing that I believe those press conferences have achieved is also to help us with misinformation and conspiracy theories that have surrounded the whole pandemic since the World Health Organization declared it a global pandemic in February of last year. So it has helped us to know what is right and what information is not right and which ones we should disregard. I remember when the coronavirus scare started and people started drinking all sorts of medical concoctions. The Ghana Health Service, through those press conferences, for example, had the opportunity to engage with people who were well-knowledged, well-learned in those fields to tell people what to expect, what to do and what not to do. Because we've learned from the experience in China that they have used certain systems that have worked for them. And so people were suggesting that we could try those as well. But the
security person, in order to do their work safely, so that the vaccines arrive safely, we also need to stay safe anyway. So we will relocate whilst giving you all the information from behind the cameras, telling you all about what to expect as the vaccines are received. Just a little bit of background information that the flight carrying about 600 doses of the AstraZeneca, 600,000 doses of the AstraZeneca Oxford vaccine produced by Serum Institute of India has landed in Ghana's capital here in Accra. This delivery, of course, we know comes almost a year after the WHO first described the novel coronavirus as a global pandemic. And 8 months after the launch of the COVAX initiative, which was aimed at pooling funds from wealthier countries and non-profits to develop a COVID-19 vaccine and distribute it equitably around the world, Ghana has seen the arrival of the vaccines. The airliner carrying the vaccines landed about 10 minutes ago, is it? Yep. Yes, and we are now awaiting
doses
to be transported from the aircraft officials to where the VIPs have gathered to receive them. We do understand that subsequently the president will be the first gentleman, of course, that is to be expected, the first gentleman to receive the vaccine.
I think the information is to start from the 37 military hospital, barring any hitches. And then they're expected to be transported possibly to other health centers to give greater access to our priority at the moment. And the first point of our vaccination plan is to get our frontliners safe and protected. So the plan is to give them the first dip. And so we are expecting the healthcare workers and frontline security will be unraveled later when the officials are able to make the speeches and make that information available to us.
Of course, yes. The rollout plan in Ghana is a milestone for the initiative that is trying to narrow a politically sensitive gap between the millions of people being vaccinated in wealthier countries and the comparatively few of the world, including Ghana. We know that the AU has been trying to help the 55 member states here in Africa buy more doses in a push to immunize at least 60% of the continent's, and Africa is actually made up of 1.3 billion people. That's a little lower than the Chinese population alone as well. But do we know of the vaccine and how it works in China as well? You know, all of this conversation started when coronavirus was first identified in the Wuhan city of China.
So China was initially getting, bad press a lot for the outbreak in the first place, and they faced allegations and accusations of not alerting the international community early enough to be able to put systems in place to curb further spread of the virus. But Abdul, if you would also recall, China, or news on China, has been largely very, very unforthcoming. So not much has come out from China in the past maybe 6 to 8 months, until recently when the WHO sent a team to investigate the start of the pandemic. And it tells you that largely, as we followed from the international press, that China has succeeded in managing its cases and is still, even currently, implementing strict measures, including quarantine, to keep those numbers down. So something certainly is working for the Chinese,
of course,
that the world is learning from.
Still talking about China, and the vaccines in Africa, China has actually sent vaccines to Zimbabwe and to Equatorial Guinea as well, and they have started rolling out a program to ensure that everybody is vaccinated. And so China hasn't gone to sleep at all.
And they've always displayed their willingness to partner with other countries and other delegations from around the world to find us a collective end to this collective. From, for example, the Jack Ma Foundation,
yes,
they brought us PPE, they brought us other supportive, intellect or intelligence to bear on our fight against COVID-19. So we cannot remove China from the equation, and they continue to throw in their support in the fight.
Yes. So, Thelma, you have, as we say in the media, we believe has been approved by the FDA. Yes. Again, this is just something we have stumbled upon, but we just feel that our audiences need to know about it as well. So you may want to...
So when we initially got the information, there was no confirmation from anywhere. But on Friday, when the Ministry of Health and its partners, i.e. the Ministry of Information and then UNICEF, COVAX, and the rest, met at that very important press conference to talk about the rollout plan for the vaccination. They did let us know that the coverage would be for 260 metropolitan municipal and district assemblies, and that there will be 12,500 vaccinators involved with 2,000 supervisors, and they're expecting nearly 40,000 people to volunteer in this rollout program. So we are getting 2 FDA-approved vaccines. The FDA has come out to say they are safe and they will do the job, because there have been concerns that one of the vaccines may not be as effective against the new variant of the coronavirus. But the FDA has been quick to allay those fears and to say that, look, some protection, which is in this case is over 70%, is better than 0% protection at all. So people should have hope in the system that the vaccine will do what it's supposed to do, as we've seen in countries like the UK, where studies have come up recently, just in the past week or so, to show that vaccination has been one of the key things that have helped them to manage their cases.
Okay, so right now, I'm sure you're seeing on your screens the vaccines as they are being transported from the Emirates aircraft to the VVIP lounge here at the Kotoka International Airport, specifically Terminal 2. And we have a statement from the Ministry of Information regarding the arrival of these vaccines. Thelma might want to read that for us, even as we observe the arrival of the vaccines. 600,000 of them, we have been told. Thelma, what does the ministry say concerning this?
So here's a statement signed by the President's representative at the Ministry of Information, the Honorable Kojopon Kroma. And it's a statement on the arrival of the COVID-19 vaccine in Ghana. And I'm going to read this as I received it. It says, the government of Ghana is taking delivery of 600,000 doses of AstraZeneca COVID-19 vaccine made by the Serum Institute of India, Covishield, today, February 24, 2021. This is the first consignment of vaccines acquired through the COVID-19 Vaccine Global Access Facility, COVAX, which Ghana, among 92 countries, has signed on to. COVID-19 vaccination will be conducted in phases among segmented populations. The first segment of the population that will receive from the 600,000 doses will be health workers, adults 60 years and over, people with underlying health conditions, frontline executive, legislature, judiciary, and their related staff, frontline security personnel, some religious leaders, essential workers, teachers, and other personalities in Greater Accra Metro, including Ewutu Senya and Ewutu Senya East in the central region. A similar segmented population in Greater Kumasi Metro and Obuasi Municipality will also be covered. From March 2nd, the COVID-19 vaccines will be deployed in health facilities and designated centers in these geographical regions, and is making frantic efforts to acquire adequate vaccines to cover the entire population through bilateral and multilateral agencies. We urge you to do your part by ensuring hard work of the technical teams from the Ghana Health Service, the Ministry of Health, the Ministry of Information, the COVID-19 Task Force, and all those who have assisted in getting us this far. Our development partners are also acknowledged for their tremendous financial and technical support. It is our hope that they will continue to support in our sustained efforts in combating this virus and putting COVID-19 behind us. That's the end of the statement, Abdul.
And I can hazard a guess as to what informed the choice of those geographical locations. You recall that when there was a lockdown in parts of the country, some of these areas that have been mentioned in the statement actually came up. I mean, were some of the areas that were the hotspots, and so they went under lockdown, partial lockdown. It is therefore not surprising that they have also come up some of the areas to receive the first doses of the vaccine. But the minister designate for health, as well as some government officials, currently about to receive the vaccines that just arrived, 600,000 doses of these vaccines. And so the good news is that what it means is that at least in the next few weeks, 600,000 Ghanaians, vulnerable Ghanaians and persons who are in frontline essential workers. Do journalists fall within this? If we do,
we'll wait for Honorable Kojopo Nkrumah to send a tweet, maybe like he did the last time. And for the avoidance of doubt, journalists are considered frontline workers. So it remains to be seen whether we do get cover, Abdul. But it's refreshing to note that the Accra and the Greater Kumasi metropolitan areas and Ewutu Senya would be priority focus areas because they have had more cases, and so the attempt to make those areas a priority would be in line.
Which one? All right.
Yes, so it stands to reason, like you said, that these areas should get mention. And as the statement has said, persons with underlying health conditions will also get priority. So at this point, it remains to be seen how that will be determined. I will assume that there has to be some form of medical record that confirms that a person has underlying health conditions. We've been told that persons who are diabetic, persons who have high blood pressure, maybe low blood pressure, people who are asthmatic, and people with other health conditions may be the ones to benefit in that vein. But it remains to be seen how proof of that would be acquired in order to confirm that one indeed is making a legitimate claim to the virus. Because in other countries, we've seen instances where people who are deemed as not vulnerable have been offered the vaccine and they've taken it, and it has led to uproar. For example, those at the front line and those with
very auspicious handing over the vaccines and the
designate. We must remember that until he's 100,000 of them, and he's about to make a statement now.
Of the COVID facility and the partners, to thank all of you for your generous contribution that has led to this donation that we are receiving today through the COVAX facility. Ghana has led the way, and we can only say on behalf of WHO and the Director General, Dr. Tedros, and the Regional Director, Masidiso Moeti, that we hold
statements right now. We will summarize whatever the minister says subsequently to you, but just a quick reminder that a flight carrying about 600 doses of the 600,000, why do I keep saying 600? It's actually 600,000 doses. And the good news is that in the next few weeks, what it means is that at least 600,000 vulnerable and exposed Ghanaians will receive the vaccination, and so 600,000 of us will be free of the virus, and that for me is very good news. But also because we still need to keeping safe, keep washing our hands, using the hand sanitizers, and of course wearing the face mask, and keeping that social distancing we've become used to. There's another statement.
Yes, Abdul. The WHO and UNICEF have issued a joint statement, and that has just been forwarded to me by the Office of the Ministry of Information, and it's saying the heading is Ghana becomes recipient of historic first shipment of COVAX vaccines. And the statement reads, after a year of disruptions due to the COVID-19 pandemic, with more than 80,700 Ghanaians getting infected with the virus and over 580 lost lives, the path to recovery for the people of Ghana can finally begin. This is a momentous occasion as the arrival of the COVID-19 vaccines into Ghana is critical in bringing the pandemic to an end. The only way out of this crisis is to ensure that vaccines are available for all. We thank all partners that are supporting the COVAX facility to deliver safe and effective COVID-19 vaccines to all countries quickly and fairly. These 600,000 COVAX vaccines are part of an initial tranche of deliveries of the AstraZeneca Oxford vaccine licensed to the Serum Institute of India, which represent part of the first wave of COVID vaccines headed to several low and middle income countries. The shipment also represents the beginning of what should be the largest vaccine procurement and supply operation in history. The COVAX facility plans to deliver close to 2 billion doses of COVID-19 vaccines this year, and this is an unprecedented global effort to make sure all citizens have access to vaccines. We are pleased that Ghana has become the first country to receive the COVID-19 vaccines from the COVAX facility. We congratulate the government of Ghana, especially the Ministry of Health, Ghana Health Service, and Ministry of Information for its relentless efforts to protect the population. As part of the UN country team in Ghana, UNICEF and WHO reiterate our commitment to support the vaccination campaign and contain the spread of the virus in close cooperation with all partners, including Gavi and the Coalition for Epidemic Preparedness Innovations, CEPI. Vaccines save lives. As health workers and other frontline staff are vaccinated, we will be able to gradually see a return to normalcy, including better access to health, education, and protection services. In the spirit of universal health coverage, let's leave no one behind. It was the joint statement by the WHO and UNICEF, congratulating all parties involved, basically, Abdul, and happy to see that we, the gateway to Africa, Ghana, is the first country to receive the shipping or the supply from the COVAX facility.
Yes, but just to also remind our viewers that but in Africa, Zimbabwe and Equatorial Guinea have already received some vaccines as well, but not from the COVAX. We needed to clear that before people think that we... Yes, but the rollout in Ghana is a milestone for the initiative that is trying to narrow what people call a politically sensitive gap between the millions of people being vaccinated in wealthier countries and comparatively few who have received the shots in less developed parts of the world, whilst others have received many more vaccines. Yep. We are now receiving our very first tranche of about 600,000, and remember our population is estimated to be about 31 million at the moment. So 600,000 is, even though it's exciting news, just like a drop in the ocean for now. And what it then means is that we must, there's still a long way to go. We shouldn't throw caution to the wind, and we must continue to observe all the safety protocols we have so much become used to in the last couple of months. It's almost a year now. We got our first case, I believe, in March. That was on the 12th of March, where 2 cases were imported. Indeed, for a long time, all the recorded cases in Ghana were imported cases until we began to see some form of community spread. Said at the very beginning, throughout. But given the figures that we had seen from other countries, where in a day, in countries like the US, about 1,000 people could die. In fact, in one of the days, in the US alone, 1,200 people died. In Brazil, in one day, 900 people died. In Spain, in one day, and I'm talking about not just one day, but subsequently other days, you have 800 people dying, 900, 1,000 in Spain, in Brazil, in Italy. We had 900 people dying for almost 5 consecutive days, Thelma. And so when we had about 300 for the entire 8 months or so, even though it wasn't exciting, we still we were lucky. We said we were lucky. But in 2 months, we've lost as many people as we lost in the entire 2020. That's unfortunate, Thelma.
That is the cause for worry, but Abdul, it's all is not lost. Hopefully, as we learn more about this new disease and as we adapt to ways to cope with this new normal, some sense of normalcy will return, like the statement from the WHO and UNICEF said. Mind you that in America alone, just over the weekend, they marked the 500,000 deaths in America alone. And they held a ceremony, a minute silence to remember those who had fallen. In the whole of Africa, we've lost about 100,000 people. And that is only a fifth of what America has lost. It is in no way meant to take from the grief that people feel. And I've said on some platforms that COVID-19 has ceased to be about figures and numbers. And it's now people I know, people you know, people who are getting infected are people that you know. Now it's in the communities. You are seeing the people. You saw somebody last week. This week, the person tested positive. You have instances where prominent personalities have come out to say, look, I have tested positive. Unfortunately, we still have stigmatization of persons at workplaces, within the community, of persons who have recovered from COVID-19 being, discriminated against for whatever reason. And that I find very unfortunate, because at least those people have known their status. At least they've tested, and at least safety of their ignorance, if I can call it that, to look at those who have bravely gone to test and they have received the treatment and think that they, for some reason, are better off.
I find that very contradictory, that someone goes to test and illnesses, and yet you haven't tested, yet you are stigmatizing somebody who has tested positive. The person is safer than you who have not tested, and therefore the stigmatization must stop. Indeed, everyone must be encouraged to go out there and test, and if found positive, get some treatment and get everyone else to be safe, rather than staying away from being tested and putting the rest of us at risk. Currently, the COVID to receive the vaccines, of course, the Minister Designate for Health and his entourage, as well as the international community here in Ghana, and representatives from UNICEF and the WHO have all witnessed the arrival of the vaccines, have received them formally, and these vaccines will now be transported to other holding facilities in wait for the president to officially receive them and also be the first to be vaccinated in the country before the rollout plan is actually activated. So the vaccines, 600,000 of them.
To be our international travel terminal until we got a new facility at Terminal 3, and then the international travel was moved to that building. So we've seen Health Minister Designate receive the vaccines with his team from the Ghana Health Service, and also the world partners from UNICEF, WHO, COVAX, and all those who have come to support us. Indeed, they have the eternal gratitude of a nation, because finally we may see some light at the end of what had appeared to be a rather dark tunnel. And for those who have lost their lives in this fight, we can never forget what you've had to sacrifice for us to gain knowledge of how to live with this new disease as we go on in the weeks and months ahead.